My name is Wendy Daly. I'm a practicing pediatrician in Louisville, Kentucky, and in March of 2008, I suffered a debilitating injury to my left wrist. I was working at a clinic and helping a 3-year-old off the table. He weighed 50 pounds, but he had other plans. He tried to fly off the table, and my left hand caught him. I felt a pop in my wrist. My wrist hurt, but if I held it still, it didn't hurt, so I convinced myself it wasn't anything serious. I went to a physician, and the x-ray actually showed that my ulnar styloid, a little piece of bone on the ulnar, was still broken. He took the x-ray, gave me a cortisone injection, and put me in a splint, and had me come back in 2 months. I came back after 2 months. My wrist was still bothering me a lot. The physician I went to told me I needed an ulnar specialist, and I was referred to Dr. Louise Schecker at that time. He made me feel very comfortable, and he made me feel that there was a solution to my problem. I was feeling very scared. I was feeling very frightened. I thought I would probably have to give up practicing pediatrics and that I would probably have to retire. And I'm 58 right now. I'll be 59 next month. That's too early for me to retire. I have a full life planned. He showed me the procedure that could be done to help me regain full mobility of my wrist. It was outpatient surgery, so I was home within 3 hours. The day afterwards, I started using it right away. It was in a sling and I had it up, but I was still using my hand. There was no rehab, and there was no special exercises that I had to do. Nothing, no rehab at all. If you would take a look at my left wrist, nobody can ever tell that I've had surgery. The scar goes from here to here, but compared to my right wrist, you can't hardly even tell that I've had surgery. I still have full mobility. I don't have any pain. I can twist my wrist any way you want. I can lift anything with both hands. Prior to my surgery, I had a really hard time because I have to look in children's ears all the time. To hold the instrument with one hand, pull back the ear with the other, and it requires some flexibility of my wrist. I absolutely could not do that. I don't notice anything now. I have no problems looking at ears. I have no problems lifting patients up on the table or helping children down from the table. I don't have any problem at all. It's the best decision I've ever made in my life. I have my life back. I have my mobility back. I'm not disabled. I work full time. I can clean my house. I can do all the things that I couldn't do. Now I'm just normal.